And one of the most innovative people I had would actually do handshake agreements with some of the patients where he was a technologist who worked for me, and he would follow the patients throughout their day, and he would just talk to them. And, and they looked down and they couldn't find their next appointment, and they were looking at the signage. And he made suggestions for all sorts of changes just because he followed the patients all day. And I'm like, how did you get your day job done? Like, we're paying you to do IT. He goes, no, you're paying me to build a better experience using digital tools. Because now sometimes those tools are just signs on a wall that are better marked. But yeah, it was just interesting. I mean, they're listening and getting that. Are there different ways that you're getting that information out of the community of what experiences they're looking for?
Yeah, and it was slowed down a bit by COVID because of some of the restrictions in terms of visitation. But what we've aligned on is this idea that we call Go to Cambodia, and it's attached to Christopher Charles, who was the kind of the thought genius behind the lucky ironfish, which is the iron ingot fish that you drop into your pot you're cooking in, and it's a natural source of iron in your diet. Well, he came across that hypothesis and proved it out when he was in Cambodia doing his research study. He could have stayed in Canada to do the study, but he wanted to immerse himself in the country and the culture and the people, and then came across this incredible opportunity. So we have that mindset here is we call the 3 C's of design disease. If all you know about the consumer or the end user and their experience, if all you know is gleaned from a conference room, a conference call, or a cubicle, you might understand the functional needs of what they're after, but you're missing kind of the social and the emotional context that might really be the driver to truly innovate or truly meet their needs in a way that they embrace. So we're all about telling people, just go and observe. Like, you think you understand how people are using the solution today, but you're probably wrong. So spend some time, just sit and observe, watch how they're using it, ask questions, be curious. Ask like what questions. Don't ask people why they're doing something, because sometimes they can feel like they have to defend what they're doing. Ask them what. Like, I noticed you doing this. What's the reason that you do it that way? Or what's good about that? And that's been a concept that's resonated powerfully in our department. It's great to get people kind of out of their normal setting and out into various backdrops to kind of better understand how technology they support truly is used in a clinical or in a patient environment. But it also helps us identify areas of non-consumption, because sometimes people just struggle and they don't even think to ask for a better way, because they just think it's just the way it is. It's just the tedious part of my job and I'm just going to suck it up and live with it. But if we're there watching, we can sometimes help identify opportunities that a clinician or a patient or a consumer wouldn't even know to ask for.